we will now proceed under the 5-minute rule with questions, and I now recognize the gentlewoman from Indiana for 5 minutes.
Thank you, Mr. Chairman, and I appreciate having this hearing, and I hope we'll have a good discussions. I know we had a lot of discussion about competition and consolidation, and since we talk about Plato, I have to mention Aristotle about his oligarchs and oligopoly issues that he discussed when we have a business controlling the government, and that's what is happening in healthcare. Unfortunately, we don't have the markets. We have oligopolies in each sector of healthcare fighting on committees and bankrupting the country and bankrupting the families. So we need to have a serious discussion. It's going to be destruction of our country. Healthcare became the biggest driver of our national debt and debt of American families, 1 of 7 families on insolvency for medical debt. And we right now have hyperinflation of price, and the system is going to blow up, and a lot of my colleagues on the other side will offer complete government takeover, which is going to be a terrible solution. So, but we need to have a solution. So, and as you know, I'm glad that Chairman of the minority leader of the committee mentioned about Affordable Care Act, Obamacare. But as you know, that actually drove consolidation in hospitals. And as you know, a lot of, maybe not with abandoned intent, but a lot of payments were to consolidate the market, doing through Medicare. We've seen what's happening. A lot of you know what site neutrality does, where hospital overbilling Medicare, roughly $300 billion effect to our budget, and then buying enslaved doctors. Let's talk about recently Inflation Reduction Act. We give a huge subsidy to big insurance and subsidize their profits through premiums. That's another $300 billion hit to the budget. So we now have a huge problem there. And we need to have discussion, not look for the evils. There was a reason that PBMs were created, and they're not doing their job too. They're not passing along the rebates to consumer. We do not have competition in that market. Everyone is making a lot of money, and countries going bankrupt. And this is a big problem, whether it's through government subsidy, but this is a government creating monopolies. We subsidize and through Medicare, through Medicaid, through all of the bills, create barriers of entry, Affordable Care Act. Physicians cannot own hospitals. Well, physicians can be owned by hospitals, but cannot own hospitals, and a lot of mandates in insurance and all other industries. So we need to have a serious discussion. And I appreciate you being open-minded, because we all have in it together. We need to get all of the stakeholders to the table, not look who's evil, because it's like a balloon. It's going to pop up on the other side, because we have enormous opportunity for innovation. And we have to happen. This will change Americans' lives. It helps us to be a healthier country. And we have to have competition for value and outcomes, not wait until a person gets so sick and keep them alive. As long as you're not dead, they're very profitable in our fee-for-service system. And this became so corrupt. We have to have a bipartisan conversation, and I hope we can. And I hope people in your industries will be able to step up, because it's very difficult to do it here. As I always say, there is no lobby for the people here, okay? But we're supposed to be the lobby. So I appreciate a lot of my Republican colleagues bringing some transparency and conversation. So I hope my Democrat colleagues will join in some of these discussions, because we have to save healthcare. So my question, I want maybe go kind of, from looking from a PBM perspective on some other ones. If you would look from some of the key issues, including because I understand, we're going to eliminate PBMs, Big Pharma is going to do whatever they want, and that was they were created, right? But what would you do to make sure that we don't create, where we do is a lot of regulating PBMs more, giving insurance commissioners more power, create that they just go lobby more state houses and write bigger checks in the state house. And there will be oligopolies protected at the state level, okay? So this is not a solution. So what can we do in that particular industry to make sure that we have a competition for value and have people have access to proper medication, that we have more choices for consumer, and be able to have innovative solution enter in that, and how the PBM market can be more competitive. So I think Dr. Losasa, I start with you. And I think I've almost run out of time, so if you briefly can say quickly something, because you need to be very quick.
Thank you, Congresswoman. Well, there's a lot there. I think that you definitely raised some important points there. I think we do want to have a system that allows for competition in the drug space that represents a meaningful counterweight to, as mentioned earlier, the monopoly privilege that pharmaceutical companies have with patent protection. And so I guess I would say just be very cautious in closing, be very cautious about how you go about trying to regulate it, because we've seen many instances where well-intentioned regulation leads to terrible unintended consequences.
Generally, it yields back. I now recognize the ranking member, Mr. Correa, for 5 minutes.